I'll be your nurse today. I'm going to perform hand hygiene. I would review the patient's medical record and gather all my equipment. As you can see, it already is. I'm going to identify my patient by his ID band, ask him his name and date of birth. I would explain the procedure, so I'm going to be inserting an NG tube to reduce nausea in this situation, and then it might be a little bit uncomfortable, but it should feel better once it's in. I would close the curtain, and then I'm going to get everything ready, so I'm going to give him a drape, an emesis basin, and then I would give him tissues as well. I'm going to ask him to breathe out of one nostril and see which one is more clear, and then I'm going to use that nostril. So he said it's right. Now I'm going to measure the NG tube. So I'm going to start at his nostril, go around his ear, and then I would take it to his xiphoid process or his umbilicus, and then I'm going to mark that with a piece of tape. Okay, got it. And then I would apply, I'm also going to put on my gloves. Sorry, I should have done that prior. Okay, so yes, now that I have my gloves, I would apply the lubricant, and then I would start inserting the tube into the nostril. So he's probably experiencing discomfort, so I'm going to ask him to try to swallow. I would offer him some water or ice chips if he could have them. And I'm going to keep inserting until we get to the marked piece. Okay. And then yeah, if he was gagging or coughing, I would not advance, and I would make sure that it was in the right location. Now I'm going to confirm that the tube is in the stomach using a syringe. I would gather stomach acid. I would look at the color and consistency of it, and then I could use a pH strip to identify that it is stomach acid, and then I could also use an x-ray if I wanted to make sure that it was in the stomach. So now that that is confirmed, I'm going to remove this, and then I'm going to take the tube to the nose. So I'm going to remove my gloves. And then I'm going to place it on the top of his nose. And then as you can see, there's a slit, so I'm going to wrap each side around. Okay, and then I'm also going to clip it to his gown. Keeping this above stomach level. Okay, so now it's on there. I'm also going to measure it really quick. I should have also measured prior. So until we get to the blue, got his measurement, so I'd mark that down in the charting. And then I would perform hand hygiene, and I would offer to help him with oral hygiene every 2 to 4 hours. And now for removal, I would go through all the same previous steps. I would identify the patient, his name and date of birth, introduce myself, explain what we're doing. And so now I'm going to remove it. You would also flush the tube with water prior to removing. So I'm going to start by removing the tape from his nose. And as you can see, he already has a drape, emesis, and emesis basin. I'm gonna detach this. And now I would tell him to take deep breaths as I remove. Okay, and then after that's done, I would perform hand hygiene, return him to a comfortable position in bed, and clean everything up.